Hi there. Have you started noticing changes in your body lately? Maybe you're growing taller, feeling different emotions, or wondering when periods begin. If you've ever asked yourself, is this normal? The answer is probably yes. Today we're talking about puberty in girls, what it is, why it happens, and the changes you can expect in the years ahead. Welcome to Why We Connect, a channel for honest conversations about growing up, health, and understanding yourself. So let's start with the most important question. What exactly happening in puberty? And if you're a parent watching this with your child, welcome. This video is for both of you, because the best conversations about growing up happen when young girls and the adults who love them are on the same page. Section 1. Breast development. Now let's talk about breast development, because this is often one of the first visible signs of puberty, and it can feel really surprising when it begins. It usually starts with what are called breast buds, small, slightly tender areas that develop under the chest. This can happen as early as age 8 or 9. You might notice one side before the other, which can feel a little alarming at first, but it is completely normal. Both sides will develop, just sometimes at their own pace. You may feel some tenderness or soreness during this time. That is simply your body adjusting to new hormone levels. It is temporary and it gets better. As development continues, you might want to talk to a trusted adult in your life, your mum, an aunt, an older sister, about getting your first bra. There's no perfect right time for this. It's really just about comfort and what feels good for your body. And one last thing I really want you to hold on to. There is no standard size or shape. What we see in media and advertising is not the norm. The only standard is this. This is your body, and it is doing everything exactly right. Section 2. Your menstrual cycle periods. Let's talk about periods, and let me say this clearly from the start. Your period is not something to be scared of. It is one of the most natural processes in the human body. How it works. Every month, one of your ovaries releases a tiny egg. This is called ovulation. The lining of your uterus thickens to prepare a nourishing environment. When pregnancy doesn't happen, your body sheds that lining naturally. That is your period. It usually lasts 3 to 7 days and comes once a month. What to expect? First period usually arrives between ages 10 and 15. Pain may be light and irregular at first, completely normal. Some cramping or tiredness in the days before. This is called PMS. Color can range from light pink to dark brown. All of it normal. Be prepared. Sanitary pads, easiest option to start with. Tampons or menstrual cups, great as you get more comfortable. Keep a pad and spare underwear in your school bag. Being prepared means feeling confident. And if cramps ever feel severe, always speak to a doctor. Section 3. Skin, hair, and hygiene. When hormones kick in, your skin's oil glands become more active. This can cause shine and sometimes acne. It is incredibly common and does not mean anything is wrong. A gentle face wash twice a day, drinking water, and avoiding touching your face will help a lot. You'll also notice hair growing in new places, under your arms and in the pubic area. Whether you remove it or not is completely your personal choice. Both are valid. Your sweat glands become more active too. A daily shower and deodorant will handle body odor easily. During your period, change your pad regularly and wash normally. Your body naturally takes care of the rest. Section 4. The emotional side of puberty. Puberty doesn't just change your body, it changes your mind too. You might feel things more intensely than before. Happy one minute, completely overwhelmed the next. That is not you being dramatic. During puberty, the part of your brain that handles emotions becomes extra sensitive while the reasoning part is still developing. So, your feelings will sometimes feel bigger than the situation. That is not weakness, that is science. Journaling, moving your body, creative outlets, and talking to someone you trust, these all genuinely help. And if you ever feel persistently sad or anxious, please reach out to a trusted adult. You do not have to carry that alone. Now that we've covered the physical and emotional changes of puberty, let's talk about the most important part, how you take care of yourself through all of this. Section 5. Quick Self-Care Guide. Here is your quick self-care checklist for puberty. Eat well. Iron-rich foods like spinach, lentils, and eggs are especially important. Drink water, helps your skin, mood, and energy. Sleep 8 to 10 hours. Your body grows and repairs while you rest. Move your body, not to change how you look, but because it makes you feel better. Talk to someone. a mum, aunt, teacher, or counselor. You don't have to figure this out alone. Section 6. How parents can support their child. And if you're a parent, guardian, or older sibling watching this, thank you for being here. Your support makes all the difference during this time. Here are a few simple ways you can show up for your child right now. Start the conversation. You don't need to have all the answers. Just being open and approachable is enough. Validate her feelings. Instead of minimizing her emotions, try saying, "That makes sense," or "I'm here for you." Be prepared together. Help her have supplies ready before her first period arrives. It removes a huge layer of anxiety. Educate without shame. Use clear, correct language for body parts and processes. Normalizing the conversation at home means she won't feel ashamed to ask questions. Let her lead. Follow her cues. Some children want to talk a lot, others need space. Both are okay. What matters most is that she knows you're there. Remember, your child doesn't need a perfect parent. They need a safe one. Section 7. Relationships and friendships during puberty. Here's something nobody talks about enough. Puberty doesn't just change your body. It changes your friendships too. Sometimes friendships that once felt easy suddenly feel different. You might feel left out, drift apart, or wonder why things have changed. That doesn't mean something is wrong with you. It simply means everyone is growing and figuring themselves out. A healthy friend makes you feel safe to be yourself. They don't pressure you to change, grow up too fast, or do things that make you uncomfortable. If a friendship consistently makes you feel worse about yourself, it's okay to take a step back. You're allowed to outgrow people. During puberty, you may also notice new feelings or develop a crush. That can feel exciting, confusing, or even overwhelming, and that's completely normal. Those feelings are part of growing up. There's no rush to figure everything out. The most important relationship you'll ever build is the one you have with yourself. Be kind to yourself. Stay close to the people who lift you up. Remember, good friendships matter far more than having lots of friends. You're growing. Your friendships are growing too, and that's okay. The hormones, the growth spurts, the height changes, the new curves, the emotions, the questions, all of it is connected. All of it is driven by your body doing exactly what it was designed to do. If there's one thing I hope you take away from this video, it's this. You are not weird. You are not behind. You are not ahead. You are simply growing. And that's exactly what your body is supposed to do. Treat your body with kindness. Be patient with yourself. And if you ever feel confused or have questions, please talk to someone you trust. A parent, teacher, older sibling, or counselor. Asking for help is never something to be embarrassed about. This is only the beginning of our journey here on Why We Connect. If this video helped you, share it with a friend who might need it too. Subscribe and turn on notifications so you never miss a future conversation. You are growing, you are learning, and you are doing better than you think. I'll see you in the next video.